The country of Thailand is in the Southeast Asia region and is low income. The gross national income is $1,035 or less per person. The population in 2019 is estimated at 69 million, which is an increase from 2014. Thailand is the 20th most populous country on Earth. Thailand is also the 51st largest country on Earth in terms of total area. Approximately 14 million or 22% of the country's population live in Bangkok and the surrounding Bangkok metropolitan region. There is a diverse range of ethnic groups within the country that have been separated into three main groups: 75% ethnic Thai, 14% Thai Chinese, and 3% Malay. The remainder of the population fall into small minority groups that include hill tribes, Khmer, and Mon. The official language of Thailand is Thai. The growth of Thailand has declined from 3.1% in 1960 to 0.34% today. As countries become more developed, it is natural to see a decline in fertility rates and an increase in its aging population over time. The average number of children born dropped from 6 to 2 in less than 20 years between 1970 and 1990. Thailand was facing two population problems: quickly aging population and urbanization, so Thailand worked to reduce its fertility rates. But now it faces an issue with a low fertility rate. As of today, there are an estimated 1,953 births daily. The average life expectancy for a Thai citizen is growing, but there are many threats to the population. AIDS has reached an epidemic proportion in this country. At least 700,000 Thais are HIV positive or have AIDS. The death rate in relation to AIDS range between 30,000 and 50,000 fatalities every year, and as of today, there are a total of 1,473 deaths daily. Thailand successfully implemented universal health coverage in 2002, guaranteeing all citizens to receive standard public health services and physical, mental, and intellectual development. This has a favorable pro-poor outcome. The healthcare infrastructure in Thailand is well developed with good geographical coverage. There is a health center covering each subdistrict with an average population of 5,000, a community hospital covering each district with an average population of 50,000, and a general hospital covering each province with a population of 600,000. Some general hospitals have been upgraded to regional hospitals and serve as referral centers in their regions. Rural areas tend to have better primary care, and urban areas tend to be more hospital-based care. Access to rehab services and assistive devices has increased, but major geographical inequities remain, with those in urban areas having much greater access than those in rural areas. Traditionally and culturally, children and grandchildren usually care for the elderly in the household. However, increasing numbers of elderly people without access to family-based care has caused the need for long-term coverage. The National Health Act in Thailand ensures patients have the right to a healthy environment for their healthcare services, right to informed decisions on their health options, and lives under the principle of all for health and health for all. This is regulated by the legislation. Legislation incorporates inspections and requires facilities to obtain certain certifications for practice. This is how they help regulate quality in their healthcare settings. In 2001, when the 30 baht scheme was introduced, all citizens would have access to healthcare by paying 30 baht in their currency. This is equal to 97 cents in the United States. Children under 12 years of age, seniors over 60 years of age, volunteer health workers, and the very poor are exempt from this user fee and receive the services free. By creating this, they extended healthcare coverage to 18.5 million people that were previously uninsured. All workers in Thailand have 5% of their paycheck taken to help pay for the universal health care coverage. Citizens and travelers also have the option to buy private health insurance, which does cost more but gives them the opportunity to seek medical attention at better facilities that aren't so crowded and have higher paid and more qualified workers. The reason there is a universal healthcare coverage for Thailand citizens is because they view that access to healthcare for improved health outcomes is something all people should have access to. Due to better healthcare coverage and access, there has been a rise in life expectancy for both males and females. Male life expectancy went from 55.9 years to 69.9 years, and for females, it rose from 62 years to 77.7 years. Infant mortality rate per 100 births dropped from 84.3 to 11.3. With a huge increase in life expectancy and increase in babies surviving, there has been a major increase in non-communicable diseases such as cardiovascular disease, cancer, diabetes, chronic respiratory disease, and mental health problems. With Buddhism being a major religion in Thailand, they do a large amount of meditating and self-reflection, which has proven to be a positive effect on mental health. The top causes of Thailand's deaths can be contributed to cardiovascular disease and other non-communicable diseases. For successful spread of information for prevention, cooperation is needed between government agencies and community healthcare resources. The community resources will be able to spread the information at a more personal level. There needs to be a realistic time frame to change deeply ingrained behavior and be carried out by a respected organization, and encourage different organizations and agencies to work together. The food industry also needs to be involved to enhance food labeling. Large-scale education through mass media is one way to spread information. The promotion of walking and bike lanes may encourage healthy lifestyles, as well as imposing taxes on cars that enter the center of the city. Promoting education on modifiable health behaviors may help reduce the risk of cardiovascular disease.